Hi, my name's Allie. Today I'm going to be answering some questions that I've gotten lately about cystic fibrosis. Cystic fibrosis makes it difficult to clear out waste and for things to move through the cell membranes. This means that any part of your body that uses water, which is most of it, can get buildups. I never even knew what cystic fibrosis was before I was diagnosed. Honestly, I just thought I had a really bad lung infection. So far, there's no underlying cure for cystic fibrosis, since cystic fibrosis is a genetic disease. It's like having brown eyes. There's not really a cure for it. Death isn't something that's really bugged me. In my lifetime, I've had plenty of family members pass away, so I've been forced to kind of think about it before I was even diagnosed. Of course, I never thought about myself dying until I was diagnosed. Because in my family, death is such an open topic, I never really worried about it, and I continue to just know that it's a regular thing. I read a really good book the other day called Death and Dying, and in it there are some really good quotes. One of them was talking about how death isn't really death. I mean, everything is death. Birth itself is death from the womb. Becoming an adolescent is death from childhood. After I was diagnosed, the doctor sent my brother, my mom, and my dad for genetic testing to see if they also had the disease. To the extent of my knowledge, no one else in my family has been tested. The first test for cystic fibrosis is called a sweat test. Basically, they take a little chemical electric patch and put it on your arm, which causes you to sweat. Then they take a little coil and put it around your wrist, which collects your sweat. Then they send it to the lab and test for chloride, which is salt. If you have more salt in your sweat than the average person, there's a chance that you have cystic fibrosis. Then they send you to genetic testing, which is just a blood test to see if you have the CF gene. Cystic fibrosis is a recessive gene, just like having blue eyes. Both of my parents have one cystic fibrosis gene each, which means they're carriers. There are inactive carriers and active carriers. Active carriers are where they have symptoms of cystic fibrosis because the cystic fibrosis gene is active. My brother and I both have a double gene, called the double delta. For example, let's take two parents. Parent A has one blue eye gene and one brown eye gene. Parent B also has one brown eye gene and one blue eye gene. If the parents have children, 3 out of 4 children will have brown eyes, because it's the dominant gene. And 1 out of 4 children will have blue eyes. Sticking to the example, me and my brother both have a double blue eye gene, or the double delta. 1 in 25 Canadians carry a gene that can possibly create cystic fibrosis. This does not mean that they will have cystic fibrosis or that their kids will have cystic fibrosis. But your parents might have a blue eye gene and you could have brown eyes. Cystic fibrosis-related diabetes is exactly what it sounds like. Diabetes that's related to cystic fibrosis. Since cystic fibrosis patients don't usually have working pancreases, they don't produce enough insulin to help break down the glucose in their body, which of course is the cause of diabetes. No CF patient is the same. Even me and my brother are vastly different. And especially since so many environmental factors can affect how sick you are. In grade 4, I had a really bad case of pneumonia. The pneumonia scarred my lungs, making me extra susceptible to infections. Since my brother didn't have something like this, his lungs were a lot healthier than mine. I also had a lot of hospitalizations when I was a very young child, like 1 and 2 years old. But since they didn't know about it, there was nothing they could do. Since I got this diagnosis, a lot of things have changed for me. It's really changed my perspective of what I'm doing. I mean, why would you be sad when you only have a number of days to do it? I want to help people who are diagnosed with this disease. I want to help people who have to go through so much more than I do, because I'm not the only one. Even if I only live to 27, I want to make those 27 years make a difference. I want to educate people about cystic fibrosis and chronic illnesses because it changes your life. I want everyone to know that you don't have to donate to make a difference. Even smiling at anyone could help out because you never know what they're going through. I want to give a quick shout out to everyone who donated to the Cystic Fibrosis Great Strides Walk and everyone who came out to walk with me. Together, in just 3 days, we raised $710 towards cystic fibrosis research. Breathe easy.